It makes us feel special. It makes us feel acknowledged in the community. Because, you know what, we can't do it all by ourselves. No. We need you. And for all the women, all the ladies here that is here this morning and not part of the United African Women's Association, I invite you all to look into your folders. There's an application form. Please come join us. We need you. We need all the women to come together. Because you know what? When we're together, we do greater things. We do mighty things. We make things roll and we make things work. What do we say? We say girls rock. So let's rock it, girls. Let's do it. I wouldn't be doing any justice without acknowledging our dear Jennifer Minta. I didn't know she was that blessed with such a wonderful voice. Jennifer, you were awesome. Good. Thank you so much. I also want to thank our MCs. I want to thank everybody, the vendors. You know, without you, this would not have been possible. I also want to thank NSCC for making this place available to us. It is a very beautiful place. So we thank you. We thank all the organizers. We thank everybody for being part of this celebration, this event. I want to invite you all to be patient, to sit down. We're going to talk about health, empowerment. We're going to talk about what it is for us to come together as women. We're going to learn a lot, and I encourage all of you to participate, ask questions, feel free. This is a sisterhood. No one is a stranger here. Preventive care and health education. She holds membership in esteemed institutions, being part of the Royal College of General Practitioners and the College of Family Physicians of Canada. Dr. Agnes is fully licensed and practicing family medicine in Halifax, Nova Scotia. Please welcome Dr. Agnes to the podium.
Around? Oh, it's stationary. Yeah, I can. Oh, yes, that's perfect. Okay, thank you, everyone. Good morning. And how are you all doing this morning? Okay, I can move that far, can I? All right. All right. Okay, I'm doing great. In fact, I am super excited to be here for the following reasons. One, this marks my inaugural experience at this conference. Thank you. And also addressing you all as a keynote speaker. So I want to first of all use this opportunity to thank the association for inviting me here this morning. It's such an honor. Okay? Thank you. All right, and thank you so much for the lovely introduction. In addition to that, I am, oh, how does this work, Kelsey? Okay. Is it on? Thank you. Good. In addition to that, I'm a mom. I have 3 kids. My daughter is 20. And my, and my two boys are 16 and 12. You know, they are sport kids, full of energy and vitality. So you can imagine how excited I was to dash out of the house this morning, away from my own personal chaos, in order to real life examples, statistics, hard promise, and questions. Although remember, we're measuring the pressure against the walls, and if the pressure is high, you can see why it can cause damage, right? And obviously that can lead to bulging of the arteries, and we have arteries. We're all wired, we have arteries everywhere. So legs, eyes, brain, heart, kidneys, abdomen, right? Any questions so far? Yeah. I don't, blood pressure is a symptom of, we have like secondary causes, can be a symptom of, kidney problems and all that. But the main thing is that regardless, we want that blood pressure to be in the normal range. Okay, it has to be in the normal range as much as possible. It's a symptom of many, disease conditions, right? But that's why we need to manage it and, take medication or other, just to keep it in that normal range. Okay, so it's a symptom. So that I'm coming to that very good question because, yeah, yeah, yeah. We're checking the organs like liver function, kidney function. Checking for thyroid. Like I said, there are conditions that increase your risk of hypertension. Those are the things we check. Yeah. Yeah, CBC, complete blood count picture. Yes, it does that. Absolutely. Absolutely. Yeah. Another question here? Yeah. So that would depend on the location, isn't it? That would depend on the location. For example, pounding headaches, yeah, then we might want to do a CT scan, then we'll find an aneurysm, right? It depends on the location of the bulging, right? Yeah. Okay. Any question? Yep. Yeah, absolutely. I wouldn't, not dangerous, I don't want to panic you, but I would say it needs urgent attention. So I would say for you to see your family doctor, a healthcare professional, absolutely, yeah. It needs to be regulated. It's not, again, it depends, are you, yeah, I would want you to see me if you are my patient so that we can look into that further, absolutely. Okay, yeah. 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 Yeah, our body is complex. Just like we have DNA, we all, individual same. Our body physiology and function is just crazy, right? So it's unfortunate. Just like I have my best friend, she can eat for the whole of England, but she's so slim. And then I eat something, boom, I've gained like 2 kilograms, So yeah, body physiology, absolutely, absolutely. Any more questions? Yeah. Yeah. 42? 42? Thank you for that. See, that confirms what I talked about, family history. That's a strong family history there. All right? Strong family history. Okay? Any more questions? Thank you. Let's move on to the next slide. Okay, so what are the increased risk of hypertension? Stroke, right? Dementia, kidney failure, loss of eyesight, less blood flowing to the brain, heart attack, heart disease, just more, complications. I've talked about that, eye problems, retinopathy, erectile dysfunction in men, So those are the health risks, okay? Now, in terms of management, we started talking about that already. Blood work for sure. Then I talked about the electricity in your homes, electrical conduction, EKG, right? Depends on the family history. If there are family history of heart disease like cardiomyopathies, we might want to do a scan of your heart, echocardiogram. Depending, we can refer to the cardiologist. If it's in a young person, like I will be intrigued to find out if I notice hypertension in a younger person, less than 40, right? I will want to refer that person to find out why. Because like I said, age increases your risk of hypertension, right? So if somebody is younger, I would like to find, more, we dig in further, okay? Now, they might refer you for stress testing, to go on the treadmill, depending. We investigate as we find more, okay? But blood pressure, EKG, blood work, standard, all right? I'm not going to bore you with medications, but just like I said, we talked about it. High blood pressure, we want to normalize it. So some of my patients say, oh, doctor, can you give me my P pill? Yeah, we have a water pill, diuretics, take a pick, Lasix, hydrochlorothiazide, indapamide. We have the calcium channel blockers. Some of you may know that. Adalat, Novax, there you go. Beta blockers, there you go. All of that. So we're not going to go into that, but know that there are medications to normalize the blood pressure, okay? Now, my purpose of presentation, you have a question? No? Okay. Is lifestyle modifications, all right? It's so important, and I'm hoping to demonstrate that soon, okay? Right, so now, there was this, how do I go back? Yeah, so lifestyle modification is so essential and integral in the management of blood pressure. Okay, now there was this robust research done. It's called, like the Kardashians, DASH, D-A-S-H, DASH, all right, evidence-based. The reason for the research is to find out whether that can lower blood pressure, and it did. So basically, it's centered around Mediterranean diets, meaning that, so it's called, first of all, what it stands for is dietary approaches to stop hypertension. Now, if you go look at the left side, we're recommending eating more vegetables, fruits, whole grains, and the reason for whole grains is that they're rich in antioxidants, minerals, and vitamins. They help to lower your blood sugar, lower your blood pressure, as well as your cholesterol. Okay, fat-free, low-fat diet, fish, omega-3, poultry, beans, nuts and seeds, vegetable oil. So as well as reduce kidney stones, stroke, and cholesterol levels. Come on. This is a win-win for all of us. So it's not just for blood pressure, it has additional benefits, all right? So DASH diet, D-A-S-H, okay? Now, food plates. Yeah, have a question? Yeah. Yeah, nothing is silly here, don't worry. Yeah. Yeah. So I would say, they both have, but I would say don't put additional salt. Personally for me, I use all the spices and then I taste it first. At the end, if I do use, and I hardly use additional salt anymore, to be honest. So I just, use all spices. I use my turmeric, spices. And then at the end, if I feel, maybe just a sprinkle, but I hardly use salt as additional in my food anymore, no. Because those spices, they also have salt in them, yeah. So no additional, yeah. Because they're tasty anyway, all the seasonings, right? Yeah. Yeah.
and how much that impacts things because, I've been, I was doing all of those things, like eating all the things you're supposed to eat, but I was still eating quite a bit of sugar. Once I reduced that, then my cholesterol levels went down.
Yeah. Absolutely. I 100% agree with you. Yeah.
And I do have a question around obesity. Is there something that we're using now instead of the BMI? Because the BMI, I don't think is
Yeah.
helpful to a lot of people.
Yeah. Absolutely.
BMI, I'm morbidly obese.
According to BMI, I'm overweight. Yeah, I understand. The thing about BMI is that it's a very useful tool, right? Very, very useful tool. And it's a screening tool, right? That it has its pros and cons. For example, we, black, population, we have a lot of muscle in different places, right? So that increased muscle composition might on the BMI, increase your BMI range, but you have less fat composition, right? But on a slim person may not have muscle bulk, but they have increase in their percentage of the fat composition. But the BMI may not pick that up because the muscle mass is low. So those are the limitations. So what I would say is that regardless, get to the overweight category first. There are other parameters, maybe waist, hip measurement, and look at your blood work, what's your cholesterol doing, there are other parameters, but just head to the overweight, closer to the BMI as much as possible. It might not be in the BMI range, but yeah, I agree with you, for sure. Okay, there are limitations to it, just like with everything, but it's a screening tool, useful screening tool, for sure, yeah. Mm-hmm.
Something that really comes up a lot for black people, black women, or people of different minorities. The thing about BMI is that it's actually, nowadays it's used as a vanity tool, like,
yeah.
oh, you're big, your BMI is big. But BMI, when it's actually, in research, it's more about correlation and the link with disease.
Yeah.
So it's more as a disease predictor.
Exactly.
Rather than, oh, you've got a high BMI, you're a good person, or you're eating bad. So I want to kind of detach that whole judgment from BMI. It's more about if you have a higher BMI, the research shows that you are more high risk
Of
blood pressure.
yeah.
So use it as that.
Use it as a use for a reference guide.
I'm unhealthy or I'm eating too much.
Absolutely.
But it is validated.
It's validated too.
Actually, in other, in Southeast Asians, they actually have a lower BMI.
Mm-hmm.
So they're supposed to even be lower than what the standard says. So it does work.
It does work.
Personal judgment.
Yeah. Yeah. So that's why I say use it as it's a screening tool. It uses validated screening tool. Use it as a reference guide, and it's just a predictor of health conditions. All right. Okay. So food plates. So we say I always say look at it like a clock: 12, 6, 3, 9. Half of the plate, fruits and vegetables. Throw in your nuts there. 25% protein. Half of the other plate, and then carbohydrates. Whole grains, okay? Whole grains. All right? Okay. Practical illustrations. I need 8 volunteers. Okay? I think I spoke to some of them already, so let's see how many we've got so far. 1, 2, 3, 4, 5, 6. Okay, we have 8 already. Great. We have 8 already. Thank you so much. Okay. I can, sorry, could you bring, yeah. 1, 2, 3, 4, 5, 6. Let me just put this pointer here. Wait, I have a preference, 1 sec. Can you hold this for me? Sorry. Thank you. Let's see here. Just hold this one. Oh, yes. Okay. Then you can, oh yeah, so you can share. All right. So turn it, I don't want to show it yet, okay? Good. Oh, let me give you, yeah, this way. Okay. All right. Thank you. You stay there, yeah, and Elizabeth at the end. Don't show it, don't, yeah, that's it, perfect. Thank you so much for my, now, to those of you that did not volunteer, you will be, no breakfast. You are going to be banished to the naughty room until your volunteering skills kick in. I'm just joking. Okay, you all have a role, all of you. Remember I started out with COO? Yeah, you all are board of directors. Take a pick. Lungs, liver, kidney, all of you, eyes, nose, everyone, you are all what? Board of directors. Okay, where is the heart? This way. Right. Okay. Board of directors are really upset. They called a crucial meeting because we received, yes, information that the heart is not performing well. You know, underperforming. You know how it is when you get to work, you're called maybe, you know, called for a meeting. We have looked at your performance report. You know. So, yes, so the heart performance report, below standard. So the board of directors are really pissed off right now, right? So, kidney, he's very, 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 very mouthy. Kidney decides to stand up and says, you know what? I believe I'm speaking on behalf of everyone here. You know what? And I'm representing my constituency, blah, blah, blah. Where are we? Dartmouth? Yeah, which Dartmouth North? Dartmouth? Dartmouth constituency. Yeah, kidney representing, saying, I'm here because I've been doing all I've been told to do, sending all this poor oxygen blood back to the heart, and guess what? Heart is dropping the ball. Same goes for liver, all of them. They are so upset right now. And then all of them are side-eyeing lungs. You know, remember the lungs, they are just like how we are with America, best of friends, lung and heart. And then, then everybody's side-eyeing lungs. Let's see what lungs is going to say. Then lungs down says, you know what? Heart is doing the best that it could, but me, whatever amount of blood the heart sends to me, I process it. Remember, I'm a treatment. I can only treat what I've been given. I treat it, and I send it back to the heart. There's nothing, I have no problem with that. So anyway, then the heart now responds and says, I can understand, the problem, order in the House, how they do in like the Senate and all this House of Commons, order. So the tempers are all rising. He says, you know what? We are all here today because you guys know my capability. For God's sake, I've demonstrated how I perform under normal condition, right? And so there's so much I can do. But I'm working against all of these factors, right? All of them. All of these factors, right? All of them. We have stress, exercise, alcohol, bad nutrition, obesity, smoking, age. You can spread out just space in between. So I'm working against all of these factors right here. All these factors I'm working against. Come on, guys, I can only do so much. And then, let me go with smoking. Now says, oh my God, I didn't realize that smoking is damaging my vessels, damaging my heart, causing my heart to underperform. And you know what? I am going to do better. I'm going to start by cutting down smoking in view to quit. And I didn't know that this was affecting my heart. So smoking now goes away, reflects on how to do better. Thank you very much. Okay? Thank you. Same goes for alcohol. Alcohol was like, oh dear me. The recommended for men is 2 drinks or less a day, and women 1 drink or less a day. I didn't realize that I was drinking this much amount. And I didn't even realize that there's something called alcoholic cardiomyopathy. And what that means is that your heart is enlarged, the walls that I talked about thickened, is affecting, the pumping ability of the heart. So basically, so over a long time of overconsumption or drinking too much alcohol, it can cause cardiomyopathy. And alcohol is saying, oh dear God, I didn't know that. I'm going to go away and I'll start, cutting down the intake in view to, drink only socially when we want drink or two maximum a day. Thank you, alcohol. All right, let's talk about exercise. Exercise and obesity together. So exercise, wow. I didn't know that exercise helps to strengthen, my heart to be able to pump better and also improve circulation. And also, it's going to help me with my weight management. I didn't realize that we recommend 150 minutes of moderate to vigorous activity. Take a pick, whatever you want to do. Also 75 minutes of vigorous activity per week. Well, I'm going to go home and think of how, every little step matters. From someone that is not moving at all, I'm going to just take 5 minutes work, we will take it. Just move. We're not, apart from stationary objects, human beings are designed to move, right? So just move. If you want to move just your arms, just move. Just for every day or every week, no, not day. Every week, have a goal to let me do better, extra step. It's all will help. It will go a long way to help the heart. Okay, so exercise, we do that. Yep, you can go exercise. Obesity, thank you so much. Thank you, my volunteers, they're doing great. So obesity, no, did I talk about, obesity, yeah. Exercise as well will help with weight management. Obesity will say, I didn't realize that I'm putting a lot of pressure on my heart. And, and the heart is underperforming because of this. So I'm going to, continue with the exercise in view to, work on my weight reduction. There are alternatives out there. You can see your family doctor, physical exercise, nutrition, dietitian. We have, healthcare professionals that can help you in terms of weight management, okay? Thank you, obesity. Nutrition. Nutrition, I didn't know that I need to, be mindful about what I eat. Not just the quality, obviously, from the food plate, we also, the quantity, right? So we have to be mindful, and also the timing, because if you're eating late at night, you're unlikely to burn that calorie. The way the body is designed, let me just tell you, is that, okay, let's say it has about intake of 2,000 calories. Now, there are vital functions that the body needs those calories for, like your circulation or the main organs, they need that. By the time the body, utilizes, for example, maybe the body needs 1,500 to function, where do you think the rest of the 500 will go to? It's going to be stored away as fat because the body doesn't need it. The body will take what it needs to survive, to function, and the rest is stored away. Right? So we need to be mindful of the quantity, the quality, and the timing of the food when you eat your food. Okay? Right. Thank you for nutrition. Oh, I forgot to add nutrition. Hang on. So for women, 2,000 calories a day. Men 2,500 a day. Okay? Thank you, nutrition. Now we have stress. Okay. Right, I don't know how to explain this, but I was leaving my house this morning, and on my street I saw for sale, and I looked at the house, I was like, ooh, that's not bad. Beautiful house, such a shame that they can't take it with them. Maybe they're downsizing, or they're moving province, and I was like, so it got me thinking, this is not written anywhere, but I think this is a good analogy. So if you pictured stress as a house, where your foundation, for that house to stand, the foundation has to be rock solid. That foundation is your coping mechanism because stress is not going to go away. Now, there are variations, it might be mild, moderate, severe stress, but stress is here to stay. So it's how we manage the stress that matters. And that's where the foundation, the coping strategies comes in, right? So, and imagine, let's say you're building your house and you have the builders and all the, those builders are like your healthcare professionals. They are there like the, your counselors, your therapists, your family doctor, all there to help you, reinforce your house. Also, the, your meditation app, they're all reinforcing, techniques to help you, cope with stress better, right? So I tell you what, this morning, I think you were asking me, this morning, just to be, I tell you, we have I'm running a bit late. So this morning, I tell you what, I got all dressed up, right? I was happy with myself, did my meditation, and really, really feeling cool with myself. Okay, so I had already, taken my shoes and my bag at the bottom of the staircase. So all dressed up, as I came out of my door, shut the door, it's as if I entered slow motion movie. All of a sudden, all the doors, like zombies coming out from the doors, but they were my beloved children, my monitoring angels. And they were just coming out from the north, west, south, I pretended I didn't see them. I just, made my way down, making my way midway down the staircase. And then the next thing, when they noticed I wasn't giving them attention, child 1, mom, yeah. Child 2, mom, yeah. Child 3, I was like, not this morning, not this morning, not this morning. I just took a deep breath. Remember I told you my shoes and my bag was already downstairs. I just slowly picked up my shoes and my bag, turned around and faced them. I mean, they are here, but for purpose of demonstration, turned around and faced them. I did an Arnold Schwarzenegger style. I'll be back. Took to my heels, left the house, jumped into my car, boom. Now I'm laughing about it, but then my energy was drained this morning. Felt so overwhelmed. I was with these kids last night. None of them said a thing. But this morning was their own perfect time to come and bust my bubble. No way. I just said, no, I'm going to do an Arnold Schwarzenegger style, I'll be back. So, because all the triage, all the things they were saying, none of them was urgent, that needed any urgent attention. They're not ill, they had a good night's sleep. That can wait. So, what I'm trying to say here is that I'm now in a better mood, smiling about it, because I'm positively distracting myself with wonderful people like you. Now, when I go home, I'm not in a foul mood anymore. I have mental clarity. Now I can look through, I can sort out my task, logically, productively, creatively, and maybe come up with a better outcome, all right? So meditation is so important. Maybe because the meditation I did this morning, I don't know, I was just in this calming spirit. So I encourage meditation, relaxation technique, do what makes you happy, what will bring joy to you. Stress doesn't go away, right? And maybe when you get to work on Monday, and then your boss now says, oh, we have these are the tasks for the week. He was like, okay, this one, Monday basket, this one I'll do now. Wednesday, Monday basket. Ooh, what's that? I better do an Arnold Schwarzenegger for that one. Or, but then it gives you clarity of mind, and then you can focus on your task better, okay? So thank you, stress. Now we have heart and age. Okay. So I guess age here is feeling important, right? I suddenly maybe feel that she's in a beauty contest. Ooh, all the other contestants have all been eliminated. Ooh, it's just me and heart. Let me check out my competition. She's not that bad. I think I'm taking home the crown, Miss Canada. Right? So let's give age attention, right? Age, obviously. I hear there is nothing we can do about getting older every day, correct?
Yes, it is.
Okay, now listen up. Listen up real good. Now, this baby girl right here will do everything, and that includes smoking cessation, reducing my alcohol intake, eating better, managing my stress better, and generally looking after myself psychologically, emotionally, and physically in order to live longer and, by the way, age fabulously well. Who wants to live longer and age well? There's a growing need, there's a growing aging population, right? And how do you want to age? Do you want to age well or not? The choice is yours. How adopting healthy or implementing healthy lifestyle choices would help you towards that, okay? Now I'm going to skip time. And heart now suddenly says, you know what, board of directors, I've got this, right? I've got this, I think I know what to do better. The reason is, and then kidney says, tell us, what are you going to do? Then heart says, all the factors that have been affecting me, preventing me from performing well, have either been eliminated or reduced. And you know what? I can work with age right here, because age is doing everything in terms of, you know, lifestyle modification to help me, heart, function better, and I will help age live longer. And that is how heart and age lived happily ever after. I haven't finished. Okay, I'm running out of time. Thank you very much. Okay, I'm pressed for time. Okay, what's happening here? Real life example. Just don't tell me, sorry. So, I think it's important just to take home message. So, okay, let me skip. So that was me there. Yeah. In fact, the caterer for this event, it was her birthday party. We took that, isn't it? Yeah. July last year, that was me. Yes, and that's me now. Check me out. All right. So that wasn't easy, but practice, yeah. So I needed to personalize my journey. I needed to own it. I needed to be accountable. And, you know, in medical school, we had too much information. But then we needed to kind of, you know, think of how we're going to store this information. And usually through acronyms or mnemonics, so we can store them and be able to produce them on a normal condition, exam condition. So I used my own technique. So basically, discipline. I was watching Kobe Bryant video one time, and he asked, how do you stay on top of your game? He says he does the same thing, like routine, same thing over and over again. I'm going to skip. Resilience, finding strength from, you know, keep going, don't give up. Rest, you need to rest. I wasn't exercising every day. I exercised good week, 6 days a week. I always had rest day. You need to rest your muscles, okay? Aspiration. Why do you want to lose weight? You're going to work, you're going for a work interview. They ask you, why do you want to work for your company? Well, I had to ask myself that. It's like having an out-of-body experience. This is me, spirit, my body. I was asking my body, why do you want to lose weight? Like, you need to have have a goal and anchor your aspiration, to your goal. Your goal have to be specific, measurable, attainable, you know, reliable, timely. Not saying, oh, doctor, I want to lose weight, I want to lose, 50 pounds in 1 month. That's not realistic, right? I lost that over 18 months, right? Not over 18 months. Yeah, I'm now October, yeah. So nutrition, I've talked about nutrition. I'm not going to say that more. Exercise, salute I will talk, because anytime I lost weight, I used to salute myself. I'll buy myself anything that will keep me focused on my goal. That's maybe gym wear or if I lost weight, when I lost a dress size, it was fantastic. I went and bought myself a dress that I wouldn't have bought if I didn't lose weight. So anything that reinforced my goals, I did. So that was salute. And I didn't care whether I lost only 1 pound. Have you weighed 1 pound of sugar? Oh no, I was saluting myself. Half a pound, I will take it. It's less than how much I was weighing before. So salute yourself, all right? Steps, we recommend 10,000 steps. I was doing up to 20 at some point. I'm not doing that now. I'm trying to maintain. I don't want to lose too much, but there. So yeah, 20,000 steps. I've talked about how to manage stress, all right? Okay. Okay, so more information, you go to my YouTube channel. I have that smoking cessation. I talked about that. I talked about my personal weight loss journey. Yeah, watch that, because that was my aspiration. My son, my 12-year-old son, Chiki, that was, you find my aspiration, my why. Mental health, smoking cessation, diabetes. I talked about hypertension there. Also, you go to my website. The episodes are there, all right, my website there, and also on my channel, so whatever, social media. Okay, statistics. Canada here saying that almost 50%, that's 45.1% Canadians live with at least one major chronic disease in 2021. So this statistic is very recent. And the prevalence of chronic condition increases with age, which is what I talked about, age, and higher in females, ladies. Did you hear that? Higher in females. All right, and the common conditions in Canada, 2021, overweight, obesity, arthritis, high blood pressure. Hence, I needed to take time to demonstrate that. So it's visual, it's in your memory. This is the statistics, Canada, right? And then most of these comorbidities, multiple morbidities, meaning you have obesity, arthritis, blood pressure, 3 health conditions, was found in low-income household. All right, chronic diseases increases with age. I've talked about 65. The prevalence of heart disease and obesity is increasing, and 1 in 12 Canadians, like I say, have multiple morbidities. All right, higher in females. All right, okay, I'm skipping through. So that's the prevalence. So you can see the graph there. I talked about this is the age category. So the yellow ones are 65 years and older. You can see it's topping the chart. Stroke, COPD, heart disease, diabetes, cancer, asthma, blood pressure, arthritis, a little bit of obesity maybe, but definitely overweight. That's the spread. 65 years and older, Statistics Canada, this 2021, okay? Then 3 or more chronic conditions. You can see, now I wanted to show this chart. Sorry, I wanted to show this chart because guess what, ladies? We are carrying the baggages, right? You can see that. We compared it with men. Across all age group, 18 to 34, the females are the ones in the yellow. Across, that was what's shocking when I saw this graph. Even 18 to 34, women were carrying the baggages. 35 to 49, 50 to 64, over 65, we have more health conditions compared to our men. Okay? And you may want to ask why. Well, we're living longer, that's a plus. More than them, statistics, women live longer than men. And possibly because of, you know, our body physiology, autoimmune conditions, you know, like I talked about that can affect your organs and what have you. So there are a lot of factors, but yeah. And then, so now, I want to talk about this slide, household income. So if you look at the one on the left, my pointer is not working, on the left there, that's the low-income household. And what are the people in the low-income household? You know, minority population, racialized, indigenous group, women, you know, multiple facing disability, maybe single family homes, right? And maybe women working in low-income jobs, less than their potential. That happened to me in the early days in the UK. I mean, when my medical degree was in Nigeria, but I couldn't work right away as a doctor in the UK then. You have to go through these hurdles and exams and what have you. And it took some time, and I had to settle for lower-income jobs, right? And that was me with my daughter then. Now she's 20, then she was, you know, a few years old. So yeah. So sometimes, you know, we drop in the low-income, you know, category because of, you know, complex family dynamics or circumstances. That drops us in the income bracket there. And that increases chronic, that's what we found, that people in low-income household, the risk there with 3 or more comorbidities, okay? Now, so why I'm saying this is because I am passionate about health promotion initiatives for the general population. I'm a family doctor for the general population, but I'm particularly interested in the Black population group, and because addressing health inequality and equity requires a comprehensive, multifaceted approach utilizing various strategies, and one of those strategies is health education and supporting healthy lifestyle. Now, as a Black female doctor and immigrant, you know, I'm using my skills and expertise in order to raise the prevalence of chronic health conditions in our Black population, and hopefully expand to outreach programs utilizing educational resources that are not only culturally acceptable but accessible within the Black, you know, population, so that will stimulate engagement, you know, increase optimization and of these resources so that they can implement it towards their wellness, thereby reducing chronic health conditions, morbidity, as well as mortality. Okay? So now, Heart Promise. I said a lot. She has that condition I talked about, autoimmune condition, the systemic lupus erythematosus attacked her heart and then blocked her arteries, and she needed a life-saving procedure. And besides, she sang a song about heartache. So I would love all of us, 1 minute, to be on your feet. Did you think I was not going to give you a task? All of you on your feet. You know, we're not, vocalists here, but I wanted us to, let's sing the chorus of this song, and then you're thinking of how you're going to implement, lifestyle changes, help, in order to moving forward, okay? All right. How are we going, Kelsey? Okay. So Tony Braxton on Break My Heart. Is it playing? When technology works, it works. Let's rewind it a little bit. Can you rewind it a bit? Okay, let's rewind a little bit. Ooh, no, it's gone forward. See, when IT works, it works. Come off it and then play it. Okay, just play and increase the volume. Okay. Break my heart. Say you love me again. Come on. Undo this hurt you cause when you walk out the door. See? Come on, ladies. Break heart. My heart. Ladies, I'm mandating all of us, okay, to unbreak your heart, your spouse, your children, your family, your community, unbreak your heart by adopting healthier lifestyle choices so that you can live longer, to thrive and be well. I'm encouraging all of us to continue to strive to become the best and the healthiest version of you all. And I'll see you all soon. Thank you so much. Thank you.
Wasn't she amazing? Honestly, I did sciences when I was in high school, but it's been a while. This was so amazing. I was so engrossed in what she was saying, I forgot that I was supposed to be keeping time. So, thank you so much. You explained it so well it was kind of hard for the dummies. And so, not that we're dummies, but
I know.
Anyway, so thank you so much on behalf of the UACWA. Please accept this.
Thank you. Thank you so much. Thank you. Thank you.
For Agnes.
Thank you. Okay. Thank you. Oh.